And thanks everybody for being here. It's going to be another interesting progression forward, hopefully, of the conversation that's been had to date. What I was going to talk a little bit about was pharmacy services, but also about the place that pharmacy services might have in the health strategy. And the Minister is going to speak a bit more about this when he comes this afternoon as well. As you know, we've covered it in a range of places, and probably most people in the room have been in some sort of conversation about the health strategy over the last few months. There has been a refresh going on. The previous health strategy was released in 2000, so for 15 years we've been working under one umbrella, and it was time to have another look and see whether all of that was still relevant, and if not, what else would we want to look at. So the health strategy has been out for a very extensive consultation, and so has the first version of the pharmacy action plan. So continuing the theme a little bit around, what have we been hearing from people, I thought we would focus first of all on the health strategy level. When we went out to consultation, there were 5 themes, and they resonate with what's been talked about so far. The people-powered theme was about, first of all, people being enabled to look after their own health as much as possible. The health literacy theme, listening to consumers and their families and their voices around what they wanted or what they needed. Not necessarily that we could always deliver on the wants, but certainly our aspiration should be to deliver on the needs. So people need to power the system much more than they are at the moment. There is no way, with all the pressures on the system, that health professionals are going to be able to get ahead of the health needs of the population. And so we need to engage the populations and individuals much more. Care closer to home, this has been a theme for many years. How do we not to underestimate the importance of our hospitals, but how do we get more services closer to home to people where that's possible? Thirdly, we need a high-performing system. How do we measure that? How do we measure value? I'll talk a bit more about that in a minute. One team, we've talked a little bit about that already today, was across professions, across organisations, across parts of the structure in the health system. How does the Ministry and the District Health Boards and PHOs and pharmacists organisations work? How do they all work together much better? And technology, we can't go far these days without talking about technology. So those were the 5 themes. So what did we largely hear? Well, we've got a few snapshots here of quotes that came out of submissions. There were written submissions, there were face-to-face meetings, there was online opportunity for people to talk about those 5 themes. Now, I'm not going to read all of these out. I'll give you a little bit of time to read them for yourself. But the first one is talking about the general trend towards technology enabling consumerism, and for this whole trend of people looking after themselves, people going online, people getting their own information. They don't rely on health professionals in the same way as we have before, and the expectations of consumers continue to change at a rate of knots. And the second quote here is just a reinforcement of what's been talked about already, I think. In the services closer to home area, it was quite interesting. The main feedback was clustered at 2 ends of the life cycle. So there was quite a bit of a conversation about end of life and the last years of life, or the needs of older people. And there was some feedback around the health strategy's first draft that some of this was a bit silent in the strategy. The health of older person strategy is being updated at the same time as the wider health strategy, but nevertheless it was a valid point that this was probably a little less emphasised than it needed to be. And on the other hand, the similar criticism was there for the young, and the health strategy's been strengthened a bit in how it addresses children and youth. Value and high performance, how do we measure this? And I think the first quote is, again, a reinforcement of the theme that we've just been talking about. The needs of the system, or how we measure value and performance across the system, can be a bit different than how we measure value and performance from an individual's perspective. So our challenge going forward is how do we construct a value and performance framework for pharmacy ultimately within a wider health strategy that recognises both the need to understand this from an individual consumer perspective and measure value from that point of reference, and also to look at it across the whole system, because they will be different. One team, we've talked about that a little bit already, and the importance of linkage, if not co-location. And earlier in the Pharmacy Action Plan conversation, this was identified by the steering group, and it's been identified in a whole lot of the forums since, that one of the biggest issues for integrating pharmacy into the health sector in a more effective way is that there's a real lack of understanding and dare I say it, even professional respect between parts of the medical profession in pharmacy, and even within pharmacy, some of the leadership and the perspective across clinical pharmacy services, be they in community pharmacy or in hospital teams. This is not a unified one team approach, either at a professional or a model of care or a business model level. So a lot of work needs to go into this, and in the Pharmacy Action Plan there are some specific actions talked about to try and address this particular piece. And the smart system, I'm not sure that we need to go into this. As Carolyn says, IT systems come up all the time. We know that the system, be it at a health strategy level or at a pharmacy level, is very frustrating to most who work within it, be they consumers or providers. Our systems tend to be pretty antiquated, they're certainly fragmented, they don't serve anyone very well at the moment, and so you will have heard within the strategy consultation, Pharmacy Action Plan consultation, the talk about a new IT strategy for New Zealand. This need is strongly recognised, and we really do need to do something about it. The second quote here from the Medical Association talks about while they're strongly supportive of the idea of a common clinical record, we need to be careful that in our drive for using technology, we don't leave any part of the population behind, and there is an equity lens that needs to go on this. So where does that leave us if we think about those 5 themes and the feedback from all the consultations that have gone on in the last few months? How does this relate down to a pharmacy level? Well, people need to drive what matters most in health. That is a common theme that we've all been talking about so far. How does that play out in the pharmacy role in public and population health and in acute demand? Well, there are some recommendations in the action plan that address that. How do pharmacists support people to manage their own medicines? Where do we provide the clinical advice, the clinical services that enable people to do this, first of all, as much as possible for themselves, and second of all, as close to home as they possibly can access it? And what do accessible services really look like? There are a whole lot of examples across the system that we might think about in that space, and community pharmacy is certainly accessible for people who want to walk through the door. Do we have clinical pharmacy services as accessible as they need to be within other clinical teams? That would be a question that we need to address. Services as close to home as possible are about people doing their own thing within their own homes. So how do we enable that as much as we possibly can? The vision in the Pharmacy Action Plan is about people, whoever they are, wherever they are, that they will have equitable access and timely access to pharmacy services. And there are a whole lot of examples here in the action plan around how we might start to do that. And the third thing that really comes up in all of the consultations, be it at the health strategy or the Pharmacy Action Plan level, is this question of setting. What should we have in community pharmacy? What should we have within integrated clinical teams? What should we have in aged care, for instance? So settings certainly will be a big part of the conversation. The questions about interprofessional linkage. The Pharmacy Action Plan includes quite a bit about this. It's not just about settings. You can link professions in a whole lot of other ways. But there's a particular emphasis in the action plan about leadership. And I mentioned before the question of interprofessional respect and willingness to collaborate and willingness to change models of care so that the best people are doing the right work. And most of all, that needs to be from a patient-centric or a family-centred point of view. Leadership across pharmacy and leadership across the wider sector needs to be cohesive and much more on the same page than it is at the moment. Partnership is a theme. What does that mean as we go forward in the pharmacy conversation? And is our training best placed to deliver the sort of workforce that we need to have to deliver on all of this? So all of these things, there are a whole lot of actions in the action plan that try to address some of this. Value and high performance, I think I probably covered most of this in my earlier conversations. One of the things that underpins this that hasn't been covered so far is the regulatory regime. We do have some stuff in the legislation at the moment that's designed to protect safety and quality and value. It is certainly up for discussion and debate at the moment as to whether the settings in the legislation and the regulations are right and fit for purpose. And then in the technology space, beyond information systems and shared care records, what about robotics? What about wearable devices? What about telemedicine? The technology space in the pharmacy sector is going to be an interesting one going forward. So the action plan is still divided in this way. So we have 4 focus areas and we have 4 enablers. They sit within a framework of the health strategy, and in terms of timing, well, the next steps, the sector and the ministry and the district health board do need to work together on this. And the sector, I'm talking about the wider health sector, not just pharmacy, looking at pharmacy. The task over the next couple of days is to progress the conversation a bit further than what we've got so far. The health strategy is due for release over the next 2 or 3 months, and the pharmacy action plan will come out at pretty much the same time, along with the health of old person strategy. It's all designed to link together in terms of timing. That's me.